والمزيد من المتابعة تنضم إلينا من القاهرة ماريز جيموند الممثلة الخاصة لهيئة الأمم المتحدة للمرأة في الأراضي الفلسطينية. أهلا بك. إذن كيف تقيمون الوضع الإنساني للنساء والفتيات في قطاع غزة بعد مرور عام على الحرب؟
Good morning, Ms. Okul. Look, sometimes I find it, I wonder what words to use to effectively describe the situation that the women and girls in Gaza have been facing for the last 12 months, the horrors that they confront every day. I was there last June, and even though I had been, continuously, obviously in discussions and talks with Gaza and people in Gaza and our teams in Gaza, I don't think I was fully prepared for what I saw then. It really defies description. The level of destructions, the level of devastations is just unimaginable. And that people have been put in this situation for 12 months is also extremely difficult to understand. I don't think I will ever be able to forget the first time I went in through the crossing, and then what you see. And what you see is devastation, is destructions. It's kilometers after kilometers of people living in makeshift and in tents. It is extremely challenging type of situation where people are basically locked into the space, in a space of scarcity. When I came out of my visit in June, I was saying that, what I had seen and met, the women I had met were stories of loss. And I would say it's stories of loss, of pain, of struggles that are difficult for anyone to understand how difficult and dire the situation is. And we're not seeing it improving. Far from it. It only is getting worse. I've been speaking with colleagues of mine who have been since I've been there, and the situation is actually now more dire than when I was there, and I found it, as I said, extremely, extremely difficult. We have to understand that 90% of the population, that's 1.9 million people, have been displaced multiple times. Sometimes some of the people I had met had been displaced at that point 5-7 times. Now we're talking 10 times. Every time they're displaced, they lose even more. The little that they had been able to leave with the first time, well, by the second time, the third time, the fourth time, the fifth time, it's not there anymore. And you have communities that are being completely dismantled. You have families that have been completely wiped out from the map. So understanding how dire it is critical. And as I said when I started, we're finding it very difficult to translate this into words, so people can fully understand what is the reality for the people currently living in Gaza, living in smaller and smaller spaces that are unsafe. They've been told multiple times to move to what we describe as safer areas that turn out not to be safe, as we've seen. So I would assess it as an extremely difficult situation, and that's saying very little.
نعم. كيف هي الأوضاع الصحية تحديدا للنساء والفتيات في قطاع غزة وفقا لما رأيتِ؟
Look, we issued last month a gender alert on health of women, where we actually indicated that we estimated that 30% of women were facing life-threatening health risk. That's 177,000 women. And they're facing those critical risks with 84% of health facilities either completely damaged or destroyed. So it's again, difficult situation. You have 162 or nearly, up to 162,000 women with either diabetes, hypertension, cancer, and so on, and with little access to medical care or facilities. You also have pregnant women or lactating women who also are facing extremely dire situations. So overall, when you're looking at the health situation, it's extremely difficult. And, you know, we were, I think, a few weeks ago saying that there was only 19 out of 36 hospitals who were partially remaining functional. The others had been completely destroyed. So you can imagine the difficulties that women are facing. You can also, I mean, I have such respect for the medical staff in Gaza who have, for the last 12 months, been trying to offer these services, often without medication, often without having the proper medical equipment to provide this. So overall, I would say it's an extremely difficult situation. And again, not something that is improving, far from it.
طيب، في ظل هذا، ما أكثر المعوقات التي تواجهونها في إيصال المساعدات للسكان المتضررين عملياً من الحرب في قطاع غزة خلال العام؟
I think, one, it is important to understand that Gaza, even before this war, and I do underline this war, was already, you know, facing major challenges. It had been under a blockade for 17 years. It's been under an occupation for, you know, 57 years. So there were issues before. Now what we've been facing is, as you see often, the obstruction of aid, the difficulties that we're facing in trying to get aid in. Of course, we're staying, we're delivering, but we're delivering in a very challenging situation where we are, you know, facing difficulties in entering the aid. That's why we keep saying that we need all land crossing to be open so that we're able to cover the full Gaza Strip, to go across the Strip and provide the needed items. We also need to understand the infrastructures, as I've said, and that includes also the roads have been seriously damaged. And there are challenges that are based on that and trying to bring aid to everyone. So again, the importance of ensuring that all land crossing are open is fundamental. This being said, earlier I referred to the fact that people are being also displaced to ever smaller spaces that are not equipped to respond to the needs of all of the people coming in. So we need to understand also that we're moving into, we're dealing with 1.9 million people displaced, and displaced, as I said, with every time even less. So also these are obviously affecting some of the work that we're doing and how we're able to respond. This is why we have chronic medical shortages of medications and equipment, why we're talking about food insecurity. Look, in March, we were reporting that 4 out of 5 women that we had surveyed were saying that they were skipping meals so other members of their families could have access to food. And this has been going on for 12 months. You know, it comes back every week. We have a new issues. We were talking earlier of the health situation. Look, you have women shaving their heads because there's no soap, there's no water, and we're looking at infectious diseases. So this is some of the realities that are being faced. And this has been, as I said, ongoing for 12 months now.
نعم. ما الأولويات المطلوبة الآن لحماية النساء والفتيات في التصعيد المستمر في فلسطين؟
Look, I think the first one would be an end to the war. There has to be a stop to this war. Every day that this war goes on, you have more destruction, more loss, more people being killed, including women and girls, as we know. People are being, I mean, this is tearing apart the social fabric of Gaza. It is, destroying communities and families and so on. So that would be the first element. What I would say also, women-led organizations, and I cannot underline this enough, have played a key role from the start of the war in supporting women and girls and providing support to communities. And we need to pay attention to the fact that they themselves have been multiple times displaced. They've faced, their offices being destroyed and so on. They've also faced reduced funding in a time where there's actually more needs for them to lead and to provide those services to women and girls. So I would say one of the elements is to ensure that the women-led organizations in Gaza are effectively well equipped and have the resources so that they can provide the needed support that is needed for for the women and girls. I cannot underline enough also the importance of safeguarding rights and the dignity of people. And that was something when I was in Gaza that I talked also with the women, where they felt that they were losing. It's not just losing your home or losing your loved ones, and many have lost so many. It's also losing your dignity. Which is extremely important that we ensure that we're putting this at the center, as we're putting at the center of any actions on the humanitarian response, that we put at the center the women's and the girls. It is important to realize that men, women, boys and girls, in all their diversity, have different needs, they have different concerns, and we do need to respond to all of those.
نعم. سيدة ماريز، يعني كلمينا عن وضع النازحين في رفح الفلسطينية أيضا، يعني وفقا لما شاهدتيه هناك.
Well, look, the level of destruction when I was there was, as I said, extremely elevated. You're talking about, civilian infrastructure, civilian buildings. You're looking at public buildings and so on. So they were most at that point had been displaced to, as I said, smaller spaces. So you're looking at people needing to have access to water, needing to have access to health services and so on. So it's a very dire situation. Again, they're being displaced to, and I cannot say it enough, to ever smaller spaces. So you're facing also extreme overcrowdedness and so on. And it's, you're living tents next to tents of people. You have the bare minimal, you're completely, there's no face. It's important to understand that, and important to understand the impact. 12 months of such a war. I was there for 8 days. I found it extremely difficult. And to imagine people being put in such a situation for 12 months is really difficult. When I'm looking, and this is where I also, the inspiration that I get from the women-led organization and the women and the girls who I met when I was there. I can still remember some of the conversations I had with some of the young girls, and how they wanted to have a future, how they, some of them were saying, when will this war be over? When will I see my friends? When I will be able to go home? I mean, understanding all of that is something that is part of what we do also. And I would like to say we have right now on our website a story of a young girl, Lean, 14-year-old girl in Gaza. And I would encourage everyone to read the story of Lean and what she has been through.
أود أن أشكرك جزيلا. كنت معنا من القاهرة ماريز جيموند، الممثلة الخاصة لهيئة الأمم المتحدة للمرأة في الأراضي الفلسطينية.
Thank you very much for having us. Thank you.